Hi, this is Lalit Kumar from 6th A group and I am from 5th year, and my today's topic is myocardial infarction, which is a blocked coronary artery disease. Now, myocardial infarction is the irreversible damage of myocardial tissue caused by reduced blood flow in a coronary artery due to atherosclerosis and occlusion of an artery by an embolus, or it can be by thrombus as well. Now, the next is type of infarcts, which is according to degree of thickness of ventricular wall involved, that is transmural and laminar. Now, the next is according to age of infarcts, that can be of newly formed or it can be of advanced infarcts, which can be old, healed and organized. Now the next is epidemiology. In industrial countries, MI accounts for 10 to 25% of all deaths, and it can be 5% under the age of 40, and males have high risk, and in women 40 to 60% of cardiovascular disease is seen, and over last 30 years 2 to 6% it included in rural population and 4 to 12% in the urban areas. Now the next is causes and risk factor. It can be due to tobacco abuse, alcohol abuse, drug abuse, hypertension, stress, and it can be also due to obesity. So these are the causes and risk factors. Now the next is pathophysiology, that is, as per the table you can see, it can be all the pathophysiology leads to ischemia and further develops hypoxia and reduced oxygen supply, then it leads to thrombolysis, and that is permanent thrombus which causes necrosis. Now we will go for the clinical manifestation, that can be dyspnea, fatigue, increased sweating, weakness, nausea, vomiting. Now the next is diagnosis, which is clinical features shown as below: pain, indigestion, apprehension, shock, low-grade fever, and serum cardiac markers can be CK, LDH, and cardiac specific troponins. Now the next is the images of diagnosis, that can be MRI, CT, and chest X-ray, angiography. Now the next is management, which can be non-pharmacological like counseling and education of patients, lifestyle measures, smoking cessation, diet and nutrition, salt restriction and all. And it can be pharmacological as well, that is thrombolytic agents and anticoagulation, antiplatelet agents and vasodilators, and others also like analgesics, anti-ulcer drugs and antidepressants. These can be pharmacological. Now the next is the image shown of percutaneous transluminal coronary angioplasty and stent placement. It is a surgical treatment for it, and it can also be done like arthrectomy or by coronary artery bypass graft, which is also called as abbreviated as CABG. Now complications are arrhythmia, cardiogenic shock, which includes 10%, and it can be congestion, heart failure, rupture and all. So thank you very